Hi, everybody, and welcome back to Nurse Practitioner Global Initiative's YouTube channel. Don't forget to subscribe, share with your friends, and you won't miss any of our videos. All right, the last video, we spoke about nurse practitioner burnout, and I summarized the Medscape survey of nurse practitioners for burnout and depression in 2022, and it painted a bit of a bleak picture. But today, we're going to talk about what is burnout, in particular, what is nurse practitioner burnout. I'm going to start with a story. I worked for about 11 years as a registered nurse, and then about 8 years full-time as a nurse practitioner in family practice before taking a position as a professor in a school of nursing. And though I knew that I had to maintain practice, I had to maintain my competency, and I was teaching nurse practitioner students who can spot a fraud a mile away, I was kind of hesitant to go back. I really held off. And then finally, I contacted an organization and set up some casual work, and I absolutely dreaded going in. But when I did, I thought, oh, okay, I kind of like this. This is interesting and fun. And I'm applying and integrating research that I'm aware of and new evidence that's come to light. And I enjoyed the patient interaction. So looking back, I can say, yeah, I was burned out. But what does that actually mean? So I started a search and I thought, well, let's do some academic stuff here. And I went to Up to Date to find out what the definition of burnout was. And I got some very strange things, I thought, from my search. Unipolar depression in adults, assessment and diagnosis. COVID-19, occupational health issues for healthcare personnel. Okay, that's not so bad. But overtraining syndrome for athletes, what's new in psychiatry? Oh, and sexuality and palliative care. A little odd, I thought. So I thought, this isn't quite giving me what I want. So then I went to the Canadian Mental Health Association. And they say burnout is a state of emotional, physical, and mental exhaustion caused by excessive and prolonged stress. Burnout in the course of employment can make one feel emotionally drained and unable to function in the context of work and other aspects of life. And I think that really rings true. And not only that, this burnout cycle that you can see here also rings true in that we're burned out, there's nursing turnover, then there's a shortage, then there's inadequate staffing, then there's job dissatisfaction, and then we're leading to burnout again. Then I'm thinking back to the Medscape survey. And you can see that the questions that were asked in the nurse practitioner burnout and depression survey match the criteria, if you will, of the definition. Burnout is seen as employment stress or the caused by employment stress with personal outcomes to individuals. But does that mean that burnout is a medical issue or a mental health problem? There's still some questions to be asked. Then I got to wondering, would the results of the nurse practitioner burnout survey be different if there had been some open-ended questions? If nurse practitioners were allowed to simply write in their thoughts about what burnout is. And as I've been thinking about this, I have some thoughts. And I think that nurse practitioner burnout is more complex than what we're seeing in this definition. And here's why. Nurse practitioners don't just do patient care. We don't just practice. There's a huge political component to being a nurse practitioner. We have to advocate for ourselves constantly in the media, in the general public, within organizations, with our team leaders. We have to fight for appropriate remuneration. We have to fight to be able to work, to practice to our maximum potential. When often organizations or other people on the team try to limit what we're able to do. We have to justify ourselves to everybody, including patients often. Even if they like the care that nurse practitioners provide, they often question things and wonder why they aren't seeing a physician. Those types of things happen daily and they're constant. It's to the point where the nurse practitioner profession almost has it embedded in our DNA that political advocacy is necessary for us to be able to do our jobs. And I just don't know if other professions have quite the same expectations for their members. Another thing about nurse practitioner practice is that we're often told that we see patients who are vulnerable. But added to that is that we see them for a lot of socioeconomic issues or issues that fall beyond what is normally seen in a family practice, for example. So already family practice is relentless and complex and overwhelming. And I had one person tell me that she thought that family practice settings should be part-time, all of them. And in fact, if I consider the psychologists and the social workers that I work with that I know care for clients through counseling service through their mental health issues, they often see very few patients a day. And I was told by one social worker, it's because they need time to process and decompress and debrief because of the kinds of things that they're told in their sessions. And I thought about it and thought, oh, so not only do nurse practitioners in all settings, but my experience as family practice, have to deal with the intense time pressures that are put on us, like, oh, you have to see all this, la, la, la. We're dealing with both an RN scope and a medical scope of practice. The expectation is that we'll see patients for far more than just a medical diagnosis and prescription. And yet we're not given the resources and the support for that kind of debriefing and decompressing that other people are getting. So it had me thinking, there are many elements in my mind to nurse practitioner burnout that aren't recognized in a traditional definition of burnout. And I think we're almost at a point where we're having a bit of an existential crisis, along with the overwhelming numbers and the overwhelming demands of the organizations and the clients to our services, like the other healthcare providers. So in fact, in my mind, it's no wonder that we're seeing the numbers that we are of nurse practitioners who are burned out and leaving the profession. And in fact, it's surprising to me that we aren't seeing more. I don't want this to be all doom and gloom, because what I want to do is pull together some thoughts about how we can transcend some of these issues and move toward a place where we're excited to go to work and we're happy and energized and about it again. And the challenges aren't so overwhelming that we can't cope with them. Okay, so those are my thoughts. And I fully expect to be challenged. So please add your thoughts in the comments below. Share this with your colleagues. Let's get a dialogue going. What do you think is actually happening in nurse practitioner world? Do you think we have burnout like everyone else? Do you think I'm out to lunch with respect to some of the other issues, imposing things in the back of our minds that we just can't let go of? Okay, so put your comments down below. I'm looking forward to reading them. And don't forget to subscribe and don't forget to share these videos with your colleagues.